So Dr. I Am Jumpy has prescribed Rocephin for our patient Skip Rocker, and I will be administering that intermuscle V-track. And I will first verify my patient's 6 rights, so right patient, right medication, right dose, right time, and right route, and right documentation. I will grab my medication, check it with the MAR, make sure that I have the right medication for this patient. I'll have to use a diluent for this medication, and so I want to check and make sure I have the right diluent. I would do that by verifying it on the vial, and or it could be found on the packaging. I check my vial to make sure that doesn't have any cracks or anything in it, and it's not outdated, and it's 526, so we're good. I would then go ahead and pop off the top, take an alcohol swab, and clean it. And I'm going to use my 5mm syringe. So I want to make sure I know how much diluent I'm going to put in this. And so it says that if I put 5.6 mils into this vial, then I would have a concentration of 5 milligrams per mil. So that is what I'm going to put into this, so I can, the order calls for 1 gram of Rocephin, and so I would be able to pull out 2 milliliters, and I would get my 1 gram out of this. So again, I will be putting in 5.6 milliliters into this vial, and so I'm gonna use my 6mm syringe, and I have a 22 gauge needle here, and take the cap off, and I'm just gonna make sure my syringe works, and we're gonna start by pulling air out of this vial. And again, we want to pull out the same amount as we're going to put in it. So we're going to pull out 5.6 and go ahead and do that. And then we'll put there into the diluent and draw that out. So we're going to put that in there. Gonna tap it a little to get rid of the air bubbles. All right, so again, I'm pulling out 5.6 out of the diluent. We're just gonna go like this. Okay, and again, we'll just check 5.6, 5.6, and we'll go ahead and put it in, and I did have my alcohol swab, and I have wiped down both of these. And I'm going to go ahead and put this into my diluent. Okay, and so I'm just gonna, for the sake of this, put this on here real quick. And to mix this together, I want to roll it gently in my hands until all the solution is dissolved, or all the powder is dissolved into my diluent. So I'm just gonna roll it in my hands. And I don't want to shake it vigorously. I just want to roll it until it's dissolved. All right. So then I'll want to pull out my my medication, and I want, like I said again, 2 milliliters, because each milliliter has 5 grams in this bottle now that I've put the diluent in it. And we'll and we want 1 gram for this order. So I'll go ahead and pull out 2 milliliters. I'm just gonna tap it to get all the bubbles out. Okay. All right. So I'm gonna go ahead and get rid of this needle, and I'm gonna put the safety on it, as we won't want to use this needle again to administrate the medication into the patient, as we've already used it several times. And so I'm going to put that over there. And now that I have I've put the diluted in here, I want to make sure that I mark this bottle, and I do have a little medication added sticker, and you put the patient's name, the drug, how much I've added in here, and my initials, the date and time. And so I'll go ahead and put this on here before I go see my patient. And I want to pick a location, and there's 2 different locations that I could do. I could do the ventral gluteal, and that's right here on the hip. And to do that, I want to go I'll go make a triangle, and it's a little hard to do on myself. So in that triangle is where I can administrate that medication, or I can pick the vastus lateral, and it's the middle third of the front of the thigh. And so for this video, I will do the thigh, and I will go ahead and make sure I have everything ready for when I go into Skip Rocker's room. So I'll have a clean pair of gloves, an alcohol swab, a new 22 gauge needle. Okay, so now I'll be administrating the Rocephin to Skip Rocker. And so I have got my new needle that I'll be putting on my syringe. And we want a new needle for this, just like so. Okay, and so then when I go into the patient's room, knock, knock, hello, Skip. I want 2 patient identifications, so patient's name and date of birth. So, Skip, can I just have you verify your name and date of birth? Thank you. And so I go ahead, and I would also want to check his allergies, which he is allergic to Celebrex. And so I would make sure that when I was first getting this medication, checking it with the MAR, that this isn't something that would interact with his allergies as well. I would wash my hands and put on my gloves. I want to, I'm going to be putting this in the vastus lateralis location. So the front of the thigh and the middle third part when I administrate this. And so I would have Skip lay supine or on his back, and I want him to just bend his knee slightly to relax that muscle so he doesn't tense up. And I am going to do the Z Track, so I want to pull the skin back about 1 to 1.5 inches, and I want to clean my location, so I'd pull my skin back so it was tight, and I would start in the middle with my alcohol swab in a circular motion and go all the way out, and I want to wait till it dries. And so I would go ahead and I want to go in at a 90-degree angle, and I want to hold this, and I want to aspirate to make sure that there's no blood. If there is blood, I can't have to discard the syringe and my solution and everything, and get rid of everything and start over. But since there is no blood, I can go ahead and administrate this. And so I want to administrate this slowly within 5 to 10 seconds. So I'm going to go ahead and put this in. Okay. And then I want to pull it straight out and then let go. And I could, I don't want to recap this, I'd put this in the sharps. And then I could document the location and the medication that I have administered in the patient, and that's everything.